Right now, at this very moment, plaque is building up inside your arteries, silently, painlessly, with zero symptoms. And here is the most shocking part: your annual cholesterol test, the one number your doctor checks every single year and tells you is fine, is missing the real danger completely. Today I am going to show you exactly what atherosclerosis is, why it is responsible for half of all deaths in America, the 6 warning signs your arteries are already dangerously blocked, and the one test that actually reveals what is happening inside your arteries right now. Sign number 3 is something millions of people experience every single day and blame on everything except the real cause. Atherosclerosis is the slow, progressive hardening and narrowing of your arteries, caused by plaque building up on the inner walls of blood vessels that feed your heart, brain, legs, and kidneys. This plaque is made of cholesterol, fat, calcium, and cellular debris, and it begins accumulating as early as childhood. For decades, it builds silently. The artery narrows from the inside like a pipe, slowly clogging, reducing blood flow, starving your organs of oxygen. And then one day, a plaque ruptures, a blood clot forms instantly, and the artery closes completely. The result is a heart attack or a stroke, events that feel sudden and without warning, but were actually decades in the making. Atherosclerosis is the underlying cause of approximately 50% of all deaths in westernized society. Not cancer, not diabetes, not accidents, atherosclerosis. And most of its victims had no idea it was happening. Here are the 6 warning signs your arteries are already dangerously blocked. Warning sign number 1: chest pain or pressure during physical activity that goes away with rest. When a coronary artery is significantly narrowed, the heart muscle receives enough blood at rest, but during exertion, when the heart demands more oxygen, the narrowed artery cannot deliver enough. The result is a squeezing, pressure, or heaviness in the chest during exercise, climbing stairs, or even walking fast that disappears within minutes of stopping. This is called stable angina, and it is your heart telling you that its blood supply is critically compromised. Most people take antacids and blame it on acid reflux for years. Warning sign number 2: pain, cramping, or heaviness in your legs when walking that disappears with rest. When atherosclerosis affects the arteries of your legs, a condition called peripheral artery disease, the muscles of your calves, thighs, or buttocks do not receive enough blood during activity. The result is a deep, aching cramp that forces you to stop walking and disappears within minutes of rest. This symptom, called claudication, is experienced by millions of Americans who believe it is simply aging, arthritis, or muscle weakness. It is their arteries, not their muscles, that are failing. Warning sign number 3: erectile dysfunction in men under 60. This is the warning sign that nobody talks about, and the one that shocks people most. The arteries supplying the male reproductive organs are among the smallest in the body, and they show the effects of atherosclerosis years before the larger arteries feeding the heart become visibly affected. Studies show that erectile dysfunction in men under 60 is one of the earliest and most reliable markers of generalized arterial disease, and men who develop it have a significantly elevated risk of heart attack within the following 5 to 10 years. Doctors rarely make this connection. Patients never suspect it. But the same plaque building in the coronary arteries is building everywhere, and the smallest arteries show it first. Warning sign number 4: sudden difficulty speaking, weakness on one side, or vision changes lasting minutes. When atherosclerosis affects the carotid arteries, the large vessels supplying your brain, it can cause brief episodes of reduced blood flow to the brain. These transient ischemic attacks, or mini-strokes, cause sudden, temporary neurological symptoms, slurred speech, confusion, one-sided weakness, or vision loss, lasting minutes and then resolving completely. Most people who experience these episodes do nothing because the symptoms passed. But a TIA is the most urgent warning that a full, devastating stroke may be hours or days away. Warning sign number 5: wounds on your feet or legs that heal very slowly or not at all. When atherosclerosis severely restricts blood flow to the extremities, even minor cuts, blisters, or sores on the feet and legs lose the blood supply they need to heal. A cut that should heal in days takes weeks. A blister becomes an ulcer. An ulcer becomes infected. In severe cases, tissue death occurs, and amputation becomes necessary. This is the end stage of peripheral artery disease, and it is entirely preventable when caught earlier. Warning sign number 6: high blood pressure that does not respond well to medication. When atherosclerosis affects the renal arteries, the vessels supplying your kidneys, it triggers a hormonal cascade that drives blood pressure to dangerously high levels that are resistant to standard blood pressure medications. If your doctor has struggled to control your blood pressure despite multiple medications, atherosclerosis of the renal arteries must be investigated. Now, the shocking truth about your cholesterol test. Your standard lipid panel measures total cholesterol, LDL, HDL, and triglycerides. And for decades, doctors use these numbers to estimate heart risk. But here is what research now shows: you can have a completely normal cholesterol panel and still have severe atherosclerosis silently destroying your arteries. The cholesterol number tells you about particles in your blood. It tells you almost nothing about what is actually built up on your artery walls right now. The test that actually shows you what is inside your arteries is called a coronary artery calcium score, or CAC scan. scan. It is a quick, low-radiation CT scan that directly measures the amount of calcified plaque in your coronary arteries, giving you a real, direct picture of your atherosclerosis burden. A score of 0 means minimal plaque. A high score means your arteries are already significantly affected, regardless of what your cholesterol number says. Ask your doctor about a CAC scan, especially if you are over 40 with any cardiovascular risk factors. If this video helped you, share it right now with someone who was told their cholesterol is fine and believes their heart is healthy. Because normal cholesterol and healthy arteries are not the same thing, and millions of people are learning that difference the hard way. Subscribe and hit the bell, because in my next video I am going to reveal the disease that is silently destroying your pancreas right now, with no pain, no warning, until the day it is too late to do anything about it, and it is one of the most deadly and most missed cancers in America.